Welcome back to The Explainer. Okay, so when you think about repairing a cleft lip, it's easy to assume it's just, well, a simple closure, right? But it's actually this incredibly fascinating five-dimensional surgical process. And when surgeons crack this code, they're not just closing a gap, they're literally easing the psychological burden for kids all over the world. Today, we're going to break down exactly how they pull off these mind-blowing reconstructive results. Here is our game plan. First, we'll decode the C-cleft aesthetic code. Then we're going to explore the 5 dimensions of care. After that, we'll get into the actual surgical precision behind crafting the median tubercle, unpack a really clever concept called the Taipei Pear Analogy, and finally, look at the sheer power of symmetry. Let's get into it. Section 1, the cleft aesthetic code, foundations of repair. So before a surgeon even thinks about picking up a scalpel, there's a strict mathematical foundation they absolutely have to master: anthropometric measurements. Why? To prevent what we call iatrogenic deformities. Basically, that's what happens when you try to fix one structural issue but accidentally create a totally new one in the process. If those facial proportions aren't mathematically locked in from the very start, the repair just isn't going to hold up. The renowned mentor John Mulliken actually hit the nail on the head here. He'd always emphasize that getting it right the first time totally relies on understanding the basic principles of the orbicularis oris muscle dermis complex. He bluntly pointed out that if you fail to launch correctly, meaning if you don't understand those foundational rules, you're inevitably going to end up with an iatrogenic deformity. When you decode all these essential aesthetic components, it's really like a giant puzzle. You're breaking the anatomy down into very specific zones, everything from establishing the perfect Cupid's bow and lip vermilion, all the way to predicting and managing post-op wound tension and pigmentation. Every single piece has to fit exactly within those mathematical parameters we just talked about. Section 2, 5 dimensions of care, a holistic approach. Now let's look at the bigger picture. In well-resourced medical units, cleft repair moves way past that basic functional closure. It's a progressive disclosure of care. Surgeons are bringing advanced aesthetic medicine right into the plastic surgery toolkit. So you start with a functional and aesthetic reconstruction, then move through secondary corrections like a Tajima primary rhinoplasty, and then go all the way into highly specialized stuff like aesthetic Botox, fat grafting, and even advanced lasers. It completely brings the whole process full circle. You know, in a lot of developing regions, patients might only get that first slice of the pie, the initial reconstruction. But when all 5 dimensions are in play, it's a real game changer. It seamlessly integrates function and appearance for the rest of the patient's life. And each specific dimension unlocks a totally different level of healing. Take dimension 3, for example. They use Botox, but not for cosmetics in the traditional sense. They use it for controlled muscle relaxation to make sure the scar heals soft and supple without any tension pulling on it. Or jump down to dimension 5, where they use picosecond or nanosecond lasers to specifically target melanosomes and refine the skin's pigment. It's an incredibly comprehensive approach. Section 3, the median tubercle, creating the pout. All right, let's talk about the actual surgical masterstrokes. A huge challenge with unilateral cleft lips is making sure the final result doesn't just look fixed, but looks completely natural. By really cleverly utilizing the existing labial elements, surgeons can physically craft the median tubercle, and that is exactly what creates that normal, attractive pout, preventing the lip from looking flattened out or unnaturally stretched. The secret sauce here is all in the sequencing. You tie the cinch suture first using internal sutures, and then apply what's known as the skin hook rule for downward traction, which guarantees the flops close symmetrically. But here is the absolute coolest part: the intentional overcorrection. By using a Tajima rim incision, they intentionally overcorrect the cleft ala by exactly 1 millimeter. Why? Because they know over the next 6 months, the hypoplastic cartilage is going to drop down and settle at the absolute perfect height. It's basically predicting the future. Section 4, Taipei Pear Analogy, nasal floor repair. Next up is what most consider the toughest code to crack in this entire surgery: rebuilding the nasal floor. And I've got a riddle for you. How does a simple piece of fruit help a surgeon rebuild a nose? Sounds kind of crazy, right? Well, during a casual chat in Taipei, surgeons were trying to figure out how to explain some incredibly complex 3D tissue movements to younger trainees, and they came up with an absolutely brilliant visual metaphor. It's all about augmented imagination. Visualizing the continuous mucosal and vestibular surfaces deep inside the nasal cavity is really tough for a trainee. So the analogy asks them to picture those surfaces as the unbroken skin of a pear. Suddenly, by conceptualizing the inferior turbinate flap as this simple, continuous shape, a highly complex 3D space just clicks. It becomes completely manageable. When you follow the pear analogy, the surgical steps become surprisingly clear. You literally trace the skin of the pear, starting right at the Nordhoff point. You carefully remove a little bit of bone so the flap doesn't curl up, and then you just rotate that pear skin down 90 degrees. Finally, you fix the superior pole to the piriform edge, and boom, it perfectly lines the nose and connects right to the turned-over lateral L-flap. It takes a totally daunting reconstructive puzzle and turns it into a perfectly logical sequence. Section 5. The power of symmetry. Clinical results. So why does cracking all these codes, the math, the sequencing, the pear analogy, matter so much? Well, the clinical results speak for themselves. The contrast between an initial preoperative defect and the beautiful natural symmetry achieved post-surgery is nothing short of remarkable. When the strict rules of engagement are followed to a T, the outcomes are quite literally life-changing. But here is the biggest takeaway. The ultimate goal of all this intense surgical technique isn't to create some elite, flawless designer lip for a select few. It's about establishing principles that are affordable, applicable, and reproducible, the AAR principles. By standardizing these methods, expert surgeons can take this world-class and reproducible care on humanitarian missions to developing nations, completely transforming the lives of underprivileged kids all over the globe. It really makes you think, doesn't it? When reconstructive surgery is this multidimensional, blending hardcore math with creative, outside-the-box problem-solving, what other everyday codes are just waiting to be cracked? If a pear can help rebuild a nose, what other hidden analogies might completely revolutionize surgical training next? Thanks so much for joining me for this explainer, and I'll see you in the next one.